Well, certainly there's, I think, billions of dollars every year spent on research for Alzheimer's disease. It's probably one of the #1 diseases that is getting looked at this time. Unfortunately, at this point, we don't have any cure, but there are some things on the horizon that may help slow the disease down, may help us with diagnosis, may help us with treating certain symptoms patients have during their Alzheimer's disease.
We're learning that a lot of things can be done to lessen the risk of dementia. Head injury is a big risk factor. Exercise and a good diet can very much lessen the risk of developing dementia. The diets that we emphasize are the DASH diet and the Mediterranean diet, both of which are low in saturated fat and red meat and high in fish and vegetable oils, particularly olive oil. Fruits and vegetables are important. Daily exercise is important. In fact, anything that you can do to lessen your cardiovascular risk factors will also lessen the risk of getting dementia. We know that the traditional cardiovascular risk factors of high blood pressure and diabetes also increase the chances of getting dementia. So if you can lessen your risk of those, your risk of dementia will also be less. So eat healthy and exercise.
So after diagnosing someone with Alzheimer's disease, we usually talk about what medical therapies we can offer, and there are a few that can be helpful in controlling some of the symptoms that people have, helping them function a little bit better. And then we also talk about expectations, what to expect as time goes on, and what limitations they may have. We're always very attuned to looking after the safety of our patients, making sure that someone is looking after them, make sure that they're not putting themselves in danger of hurting themselves or someone else. As far as research, there is a ton of research going on about Alzheimer's disease and a lot of new information coming out almost on a weekly basis. Unfortunately, that hasn't resulted in a new treatment within the last few years, but I expect that that will change in the near future. I think a support group is very helpful, and we're blessed to have a good Alzheimer's Association group of concerned patients and their caregivers that meet here monthly. I think it's very helpful for caregivers in particular, because when you're a caregiver, it can be really lonely thinking that you're the only person dealing with these kind of problems, but you quickly find out that everybody has pretty similar experiences.
One of the resources that West Tennessee Healthcare offers is the support group for Alzheimer's. It is offered the first Thursday of every month at 6:30 in the Medical Founders Room B at Jackson-Madison County General Hospital. If you have any questions regarding the support group, you may contact 541-6751.